Congress pushing back on the Congressional Budget Office report, which says millions more Americans will be uninsured if the GOP health care bill becomes law. Let's discuss now. Grover Norquist is here, the president of the Americans for Tax Reform, and CNN senior economic analyst Robert Reich, and author of Saving Capitalism for the Many, Not the Few. Perfect two guests to discuss this. Gentlemen, thank you so much. Grover, I'm going to start with you. So the CBO, the Congressional Budget Office, analyzed this new GOP healthcare plan, and here's what they estimate. 14 million more people would be uninsured by next year, and that would rise to 24 million more uninsured by 2026. But there's a $337 billion in deficit savings in there for from 2017 to 2026. I know you like the savings part and the tax cut, but what about the amount of uninsured?
Well, as you know, they were off by 24 million when the CBO told us how many people Obamacare would cover. They said today there'd be 22 million people on the exchanges, and it's half that. So the CBO has not a good record on those predictions. But that doesn't matter. What was big today, and what your conversation so far has missed completely, is the CBO just scored this plan, the Trump, Paul Ryan, Obamacare repeal and beginning of reform. They scored this as deficit, as decreasing the deficit, and that means that it can be passed with 51 votes in the Senate. The only thing the CBO score, in the whole thing, the only numbers that matter are $1.2 trillion in spending over a decade and $900 billion in lower taxes, $300 million, as you say, deficit reduction. What does that mean? That means that this reform package can be passed with 51 votes in the Senate, and by having $300 billion in deficit reduction, it means there's a lot of wiggle room. There's a lot of movement you can put in there to earn House Republican concerns and Senate Republican concerns. This bill is going to pass because the CBO's numbers.
We discussed that. We did discuss whether or not it would pass. But I mean, you're not saying that the 14 or the 24 million people who may not have health insurance from, between now and 2026, you're not saying that number is not important.
No, the CBO saying that number is less important because they have a track record of being off by completely off. If you look at their reasoning, they say, oh, there are going to be fewer people getting health care if we allow states to have Medicaid block granted out. There were similar hysterics against Bill Clinton when he block granted welfare, and they were wrong. So we now actually have a track record.
But the CBO was only wrong because they didn't anticipate that 19 states would refuse Medicaid.
In terms of how many people are on the exchanges, they have it backwards on that. They were wrong there. They were wrong on how many people were going to buy it. They thought that the mandate was going to force everybody into the effort. And getting rid of the mandate, they think, will make everybody get out of it. They were wrong in both directions. The most important thing is they're rating 1/3 of the Republican plan. This is the reconciliation package. It's a piece of the puzzle. Okay. There are 1,400 decisions, as you know, that Secretary Price makes, all of which can help reform this and give waivers to states.
Grover, let's set Robert
decisions to the states.
I want Robert to get in on this as well, because Robert, it says by 2018, the CBO predicts that premiums would go up 20%, 20 to 25% higher from the 64, those who are 64 years or older, and they say the report is a punch in the gut to Republicans. Explain that.
Well, of course it's a punch in the gut to Republicans, because 24 million people are predicted to lose their insurance.
You said it was a punch in the gut, it's not the CBO.
But the CBO, I mean, you can attack the CBO. The problem is with attacking the CBO. This is a CBO whose head was appointed by a Republican Congress. This is headed by a conservative Republican economist who has expressed in the past real problems with Obamacare. You can't say that this is biased one way or another. The CBO is nonpartisan, and if anything, this CBO is a Republican-run CBO. The fact that it comes out with an estimate saying that 24 million people are going to lose over the next 10 years their health care, 14 million people next year, this is not something to just poo-poo. This is not something you can just wash away. This is a huge problem, and it's not just a political problem, it's a human problem. We've got enormous numbers of people in this country who desperately need health insurance.
But he's saying the CBO's numbers were off, Robert. How do you respond to that? He said they were off by...
What I don't understand
by
the
a
argument.
lot.
I mean,
a lot.
Wait a minute. Can I just say what I don't understand? I mean, the original CBO estimate of Obamacare was off because there were changes that had to be made in Obamacare, and a lot of states did not decide to expand Medicaid coverage. So obviously, there's going to be a change in terms of what the estimate is going to be. That doesn't mean that right now we can simply disregard the CBO's estimate. This is serious stuff. There is no other nonpartisan, highly regarded estimate of what's going to happen as a result of this so-called replacement. It's not even a replacement. I mean, let's be clear about this. The Republicans said that they were going to repeal and replace. This is not a replacement. Donald Trump said, oh, I'm going to replace it with something absolutely beautiful. Nobody's going to lose coverage. Well, everybody, a lot of people are going to lose coverage. And what other source do we have of understanding the possible consequences of this other than the nonpartisan, Republican-headed Congressional Budget Office?
Grover, so what do you think? Do you think Republicans are willing to put the deficit over insuring Americans?
You have it completely backwards. We have a system that was supposed to reduce the cost of health care for Americans. The president ran on a promise that he would reduce it by $2,500, okay? And it went up, not down. This plan didn't work. It didn't do what it said it was going to do. It moved in the opposite direction. And again, both of you understand that the CBO scored one piece, okay? They can only look at what they're told to look at. The original piece that's going to pass through reconciliation. There are 1,400 different decisions Secretary Price gets to make, because when the Democrats set this up, they thought they'd be running the country forever, and they put all this power in the hands of the HHS Secretary. Now they perhaps wish they hadn't, but they did. And then thirdly, as the President has said, as Paul Ryan has said, as the Republicans have made perfectly clear, but the CBO doesn't take into account, that there are a series of changes that need to be done legislatively as well. We may need to break the filibuster and do it with 51 votes if the trial lawyers own the Democratic Party and we can't get tort reform.
This makes absolutely no sense. This makes absolutely no sense. I mean, here we have Republicans are saying, "Oh, wait a minute,
you were wrong about Bill Clinton's welfare."
Republicans are saying, "Don't worry, we're going to fix everything." This is the only solid evidence we have to date about what the consequences of this so-called replacement for Obamacare is. And if you say, "Oh, well, don't worry, it's going to get better," and HHS is going to do one thing, and Republicans are going to patch this up, and we have no confidence. There's no reason any Republican or Democrat or voter for Trump who's going to be really hurt
Robert, you were wrong about Bill Clinton's welfare reform. You were wrong about Bill Clinton's welfare reform.
I was right about it, as a matter of fact. I was right about all of that. And I look forward to debating you about that.